We are excited to have you start with our innovative light-accelerated orthodontics technology. Before you start a patient using OrthoPulse, there are a couple of things you need to do. We suggest you have the Practice Quick Start available to follow along as we outline the steps. We highly recommend the iPad or iPad mini as the dedicated device for your practice. Download the Ortho Pulse app using your iOS or Android device. In order for your patients to use OrthoPulse, you will need to activate their device using the Ortho Pulse app. Log into the app using your OrthoPulse ID that you chose when you registered on the website. When you log in for the first time, you'll see a brief tutorial outlining the features of the Ortho Pulse app. You can always access this in the app's menu for future reference. Fully charge OrthoPulse before delivering to a patient. Overnight is recommended. A full charge is indicated when the status light turns off after pulsing green during charging. A full charge takes approximately 3 hours using the enclosed micro USB cable and wall adapter. A green status light indicates that the device is ready for treatment. The status light guide is available in the manual or at the bottom of the charging case. Now you are ready to start treating your patients using OrthoPulse. To start a patient, you must add the patient to the OrthoPulse app by clicking the plus sign and filling in all required patient information. We highly recommend that this is done while the patient is in the chair, not in advance, as the patient will receive an automatic email to be referenced during her delivery appointment. Once the patient has been added, the app will automatically prompt you to activate the device. To initiate Bluetooth mode, pick up the device and place it back on the charging case. The device will be available to sync for 60 seconds, indicated by a solid purple status light. Tip: if the purple status light turns off, lift up the device and place it back on the charging case to reinitiate the Bluetooth mode. Be sure the Bluetooth on your mobile device is on. A pulsing purple status light indicates that the OrthoPulse is activated and successfully transferring data. Demonstrate for the patient how to use OrthoPulse. This could be a 10-second partial treatment on one arc or a full 10-minute treatment. We recommend that you have the patient watch the How to Use and Care video and review the Quick Start and User Guide. Note, if the patient does not have access to a compatible device, instruct them to bring their OrthoPulse to every appointment so that it may be synced. Devices have a limited memory and can store data for up to approximately 90 days. Syncing is crucial for archiving complete treatment history and tracking compliance. Remind patients to store the device in the plugged-in charging case while at home. When traveling, patients should store the device in the charging case and keep it locked to prevent damage or inadvertent battery depletion. Patients may also clean the device periodically by running it under warm water and letting it air dry in the charging case. We are excited for you to provide light-accelerated orthodontics to your patients. If you need any help along the way, visit orthopulse.com.